Mhm.
Bonsoir, mesdames et messieurs. Veuillez nous excuser pour un petit retard dû à des problèmes techniques qu'on est en train de résoudre. Merci.
Oui, je peux lui envoyer un lien rapidement. OK. Pas de souci.
Je vois déjà une main levée. Est-ce que Monsieur Germain veut dire quelque chose?
Hello, Lassana. Donc,
Oui,
Alain dit effectivement qu'il n'arrive pas, il a le lien, mais il n'a pas. Donc, je viens d'appeler Ali pour qu'il lui envoie tout de suite un lien.
d'accord. Mesdames et messieurs, excusez-nous, c'est le modérateur qui a des problèmes techniques. On est en train de résoudre cela et laissez-nous juste quelques minutes et on va essayer ça. Merci beaucoup.
Alors, est-ce que vous m'entendez?
C'est le docteur Davimba?
Oui.
Très bien, on vous entend.
OK, merci.
Oui, docteur Dabiba, on vous entend.
OK, merci.
Merci beaucoup. Mesdames et messieurs, une fois de plus, désolé du retard indépendant de notre volonté. Quand les dieux de la technique ne veulent pas, ils ne veulent pas. Maintenant, on est prêt. Euh, Bonjour et bienvenue à ce webinaire. Je suis Lassana Barry. Euh, je suis spécialiste communication pour Pathfinder au Burkina Faso. Avant d'introduire ce webinaire, je voudrais rappeler quelques instructions qui vont nous permettre de bien passer un bon moment ensemble. La première chose, je voudrais rappeler à chacun de couper son micro quand on n'a pas la parole. La deuxième chose, chaque panéliste doit ouvrir son micro et sa vidéo pour qu'on voit à qui on parle. Et la troisième chose, le webinaire est transmis en français et en anglais. Il vous suffit juste d'aller sur l'onglet interprétation pour choisir la langue dans laquelle vous souhaitez écouter ce webinaire. C'est donc un réel plaisir de vous compter parmi nous pour ce quatrième webinaire organisé par le projet USAID AmplifyPF, donc un projet financé par l'Agence des États-Unis pour le développement international et mis en œuvre par l'ONG Pathfinder au Burkina Faso, en Côte d'Ivoire, au Niger et au Togo. En rappel, cette série de webinaires porte sur le thème global, je cite, gestion adaptative des pratiques à haut impact, faire face à la diversité des contextes. Le premier webinaire de cette série a porté sur la contribution des formations sanitaires non gouvernementales dans l'offre de services de planification familiale au Burkina Faso. Le second a abordé le thème approche de mobilisation des ressources locales par le comité technique d'appui au réseau de services de planification, au réseau intégré d'apprentissage au profit des formations sanitaires au Niger. Le troisième était consacré à l'expérience de collaboration avec les chambres préfectorales des métiers dans la mobilisation des jeunes pour leur accès aux informations et services de santé de la reproduction et planification familiale de qualité au Togo. Aujourd'hui, nous parlerons des journées spéciales planification familiale, une approche pour réduire les barrières financières à l'utilisation de la planification familiale en Côte d'Ivoire. Pour modérer ce quatrième webinaire, je suis honoré de vous présenter le docteur Alain Damiba, expert de santé publique avec plus de 30 ans d'expérience clinique, programmatique et de gestion exécutive. Dr Damiba a une grande expérience du développement des programmes de santé, de la planification stratégique et de la mise en œuvre des projets dans plus de 50 pays en développement. Il a occupé plusieurs fonctions importantes avec JPAEGO, notamment celui de vice-président senior chargé de programmes et des approches techniques jusqu'en juillet 2021. Aujourd'hui, Dr Dabimba est basé à Accra et occupe le poste de conseiller santé senior pour le bureau régional de l'USAID Afrique de l'Ouest. Aux côtés du docteur Alain Dabimba, nous aurons une comodératrice en la personne de Madame Matt Awi. Psychologue de formation, Matt est impliquée dans la lutte contre le VIH-Sida depuis plus de 30 ans. Son expérience a débuté en 1988 où elle a travaillé pour une association spécialisée dans la prévention du VIH-Sida et l'accompagnement des communautés africaines à Paris. En Côte d'Ivoire, elle a travaillé pour le Centre intégré de recherche bioclinique d'Abidjan, créé par le professeur Luc Montagnier avec le soutien de la Fondation mondiale de lutte contre le sida. Matt a plusieurs cordes à son arc et est aujourd'hui chargé de jeunes et du genre sur le projet USAID AmplifyPF en Côte d'Ivoire. Comme panéliste, nous avons avec nous ce soir le docteur Moïse Techi. Le médecin qu'il est travaille depuis 24 ans dans la santé sexuelle et reproductive. Pendant 13 ans, il a occupé le poste de médecin-chef et chef de service de gynécologie obstétrique de l'hôpital général de Douakoui, une ville de l'ouest de la Côte d'Ivoire, en tant que clinicien hospitalier. En 2018, il fait un passage à l'OMS en tant que consultant chargé de coordonner des activités d'amélioration de la qualité des soins et se retrouve aujourd'hui à Pathfinder international en tant que chef de projet USAID AmplifyPF en Côte d'Ivoire. Sans plus tarder, je voudrais passer la parole au docteur Dabimba pour commencer la modération de ce webinaire. Docteur Dabimba, veuillez activer votre micro et votre vidéo pour que les gens puissent vous voir. À vous.
OK. Merci, Lassana. Est-ce que tu peux me confirmer que vous m'entendez?
Oui, on vous entend très bien.
OK. Merci. Bonsoir à tous et à toutes. Je suis très heureux de participer à ce webinaire ce soir avec tous nos amis de l'Afrique de l'Ouest francophone. Vraiment, je voudrais donner un petit contexte à cette conversation de cet après-midi. Vous le savez tous, l'Afrique de l'Ouest francophone, particulièrement à travers le partenariat de Ouagadougou qui regroupe 9 pays francophones de l'Afrique de l'Ouest, a eu un succès très, très fort depuis 2011, lors de sa création à Ouagadougou. Et en 10 ans, de 2011 à 2021 à peu près, le progrès qui a été réalisé représente le double de ce qui a été fait 20 ans avant la création du partenariat de Ouagadougou. Donc, ce partenariat a permis d'accélérer le progrès en matière d'utilisation de planification familiale dans la sous-région. Cela est indéniable. Et un mouvement a été créé actuellement, que ce soit au niveau des jeunes, que ce soit les pays, qui vraiment est en train de soutenir tous les efforts pour améliorer notre performance en matière de planification familiale. Cependant, les objectifs de 2030 que le partenariat s'est fixé, c'est-à-dire d'avoir au total 13 millions d'utilisatrices depuis la création de l'initiative, ça veut dire qu'il faudrait avoir 6,5 millions de nouvelles utilisatrices depuis 2020 jusqu'à 2030. Bon, quand on regarde les chiffres aujourd'hui de Track 20, on se rend compte qu'on est assez en retard par rapport à cet objectif de 2030. Donc, les succès sont très importants, mais en même temps, nous avons des défis pour pouvoir atteindre les objectifs qu'ensemble nous nous sommes fixés. Alors, pour pouvoir atteindre les objectifs de 2030, il va falloir, si on continue à faire ce qu'on fait, ça ne va pas marcher, on ne va pas atteindre nos résultats. Mais si nous décidons d'innover, d'essayer des approches nouvelles, et je pense qu'on peut avoir un peu plus de chances d'atteindre nos objectifs que nous nous sommes fixés. En général, pour ce qui est de la planification familiale, vous savez tous qu'il y a beaucoup d'obstacles, beaucoup de défis. Il y a les normes sociales qui sont parfois conservatrices. Il y a les politiques de certains de nos pays qui empêchent une mise à disponibilité de la planification familiale au plus grand nombre. Il y a des problèmes liés aux stratégies de prestation de services au niveau des structures sanitaires. Il y a la gestion des contraceptifs, parfois avec des ruptures de stock. Il y a des problèmes de leadership. Il y a des problèmes de demande, même de connaissances. Il y a des problèmes au niveau de comment nous accueillons celles qui veulent avoir les méthodes, particulièrement au niveau des jeunes. Et un autre grand obstacle, c'est les distances entre les populations vulnérables et les endroits où la planification familiale existe, et aussi les coûts des produits qui sont parfois très difficiles à gérer par les personnes vulnérables. Donc, je crois que le séminaire d'aujourd'hui a été conçu pour un peu ouvrir une discussion sur l'expérience du projet AmplifyPF dans ce domaine de réduire les coûts et aussi de rapprocher un peu les produits par rapport aux populations vulnérables et là où elles vivent. Et donc, il y a eu plusieurs approches qui ont été essayées dans la sous-région au niveau du partenariat de Ouagadougou. Bon, il y a par exemple le projet Weizou au Togo, où la plateforme santé maternelle néonatale est gratuite et la PF est gratuite jusqu'à 6 semaines, mais bon, ce n'est pas élargi à 2 ans ou ce n'est pas élargi à la planification familiale d'intervalle, etc. Il y a des pays qui ont essayé le secteur privé, qui a aussi réduit certains des coûts. Il y a des pays comme le Burkina qui ont essayé la gratuité totale, et donc en routine ou en journée spéciale, la planification familiale est gratuite. Pour ce qui est de cet après-midi, c'est une autre approche qui essaie aussi de réduire les coûts, c'est les journées spéciales planification familiale. Ce sont des journées qui sont organisées par le projet en étroite collaboration avec les autorités, aussi bien nationales que régionales et locales. C'est souvent un événement de 3 à 5 jours consécutifs, ça dépend des pays, qui se produit dans une formation sanitaire ou parfois dans la communauté, à l'intérieur du district sanitaire. Et c'est organisé en collaboration avec les leaders communautaires, les partenaires, le ministère de la Santé, les sociétés civiles, etc., etc. Et ils offrent ces événements-là, permettent d'offrir une gamme complète de produits contraceptifs. Et la particularité de ces journées, c'est que la prestation est gratuite. Et donc, dans les pays que j'ai visités, c'est absolument incroyable la différence entre la fréquentation pour la PF de routine et la fréquentation des journées spéciales. Donc, cela démontre que le coût des produits de contraception est un grand obstacle à l'acceptation et à l'utilisation de la PF. Donc, je suis très heureux aujourd'hui de voir que nous avons une opportunité pour le projet AmplifyPF de présenter un peu les expériences qu'ils ont eues, particulièrement en Côte d'Ivoire, parce que les journées spéciales ont été faites dans pratiquement les 4 pays. Mais pour aujourd'hui, on va se concentrer sur la Côte d'Ivoire, l'expérience de la Côte d'Ivoire, comment ils ont démarré, pourquoi ils ont démarré, comment ça s'est passé, quelles sont les leçons apprises et quelles sont les recommandations que nous avons pour le futur et pour des pays qui ne se sont pas engagés encore dans ces journées spéciales. Donc voilà, merci. Je passe la parole à Lassana pour introduire ma collègue co-modératrice pour commencer à poser les questions aux panélistes que nous avons aujourd'hui. Merci.
D'accord, merci docteur Damimba. Je crois que on peut passer la parole à docteur Teshi pour qu'il puisse faire la présentation.
Merci, Lassana. Parmi les obstacles à l'utilisation des contraceptions en Côte d'Ivoire, comme Dr Alain Damimba le disait, figure la barrière financière. Et pour contourner cette barrière et permettre à la population d'avoir accès à la contraception, le projet Amplify a organisé des journées spéciales dans ces districts de mise en œuvre. Alors, je vous invite à découvrir avec moi les résultats de la mise en œuvre de cette approche à travers ce webinaire dont je vous présente le plan suivant. Alors, dans un premier temps, je vais présenter brièvement le contexte de mise en œuvre du projet et ses zones d'intervention. Et dans un deuxième temps, je vais aborder les journées spéciales, présenter globalement l'approche, les résultats, avant de terminer par les recommandations pour une bonne mise en œuvre de cette approche. Alors, cette diapo nous présente les indicateurs en santé maternelle en Côte d'Ivoire. Je précise que ces données de l'EDS 2011-2012 sont des données à l'entame du projet AmplifyPF en Côte d'Ivoire en 2018. Nous voyons déjà le taux de prévalence moderne contraceptive faible qui est de 14%, les besoins non satisfaits élevés de 27%, ce qui explique un taux de mortalité maternelle à 614 000 décès pour 1000 naissances vivantes. Et aussi un grand nombre d'avortements, autour de 300 000 cas par an. Et parmi ces cas d'avortement, nous avons la population pauvre qui représente 80%. Le projet AmplifyPF intervient en Côte d'Ivoire dans 94 formations sanitaires, dont 11 formations sanitaires privées. Et ces formations sanitaires sont réparties dans 5 GRIA, donc 5 districts. Et AmplifyPF est un projet d'offre de services de planification familiale. Et dans ce sens-là, le projet a renforcé les capacités des prestataires de santé et des ASC, les agents de santé communautaire, à renforcer le plateau technique des formations sanitaires en équipement. AmplifyPF a appuyé la routine de la planification familiale dans ces districts, a organisé les journées spéciales qui est le sujet de notre intervention aujourd'hui. AmplifyPF a aussi implémenté l'approche ISBC, et ce qui est intéressant, c'est que le projet AmplifyPF a démarré la gratuité de la planification familiale annoncée par le ministère de la Santé de Côte d'Ivoire dans ces 5 districts. La délégation des tâches et la mobilisation des ressources sont des interventions que Amplify mène dans ces 5 districts. La journée spéciale de planification familiale. Il faut dire que pour booster la planification familiale en Côte d'Ivoire, le projet AmplifyPF a organisé, je le disais tantôt, des journées spéciales de planification familiale dont l'objectif général est d'accroître l'utilisation des méthodes contraceptives par la réduction de la barrière financière, et spécifiquement, c'était de sensibiliser la population sur l'importance de l'utilisation des services et surtout offrir gratuitement pendant 3 jours une large méthode de contraception aux populations. En quoi consiste l'approche journée spéciale? La journée spéciale, c'est une approche qui consiste à organiser sur 3 jours consécutifs une offre de services gratuite de planification familiale dans une formation sanitaire donnée. Et lorsque un autre site est identifié par le district dans l'aire sanitaire, on parlera de stratégie avancée ou stratégie mobile. Et cette approche est faite en collaboration avec les partenaires, la communauté et le district. Alors, les étapes de mise en œuvre. Nous avons synthétisé l'organisation de ces journées spéciales en 4 étapes. Donc, l'étape 1, c'est que nous avons dit la préparation des journées spéciales PF. C'est à ce niveau-là qu'il faut, toute l'organisation se résume à la première étape, qui est de faire des réunions avec les districts, l'estimation des besoins, des consommations, des consommables et des produits contraceptifs, la planification, la programmation des journées spéciales, c'est à ce niveau. Toutes les questions des outils de collecte de données, d'identification des prestataires, c'est à ce niveau-là. La deuxième étape, aussi importante, c'est la communication autour des JSPF. Et je disais que les JSPF ont 2 éléments importants, c'est la gratuité et la communication, c'est-à-dire la sensibilisation autour des journées spéciales. Et c'est autour de cette deuxième étape qu'il faut, n'est-ce pas, chercher à voir les canaux de mobilisation au niveau local et les ASC qui vont, ou bien les griots qui vont faire la sensibilisation. La troisième étape, c'est la journée spéciale proprement dite. Et donc, où on offre la planification familiale, les produits contraceptifs, mais dans les normes, dans les procédures et les standards. La 4e étape, c'est la gestion des données et tout ce qui concerne la collecte des données qui se fait de façon journalière. Et au bout de ces 3 jours, on fait un rapport synthétique et les données sont prises en compte dans le district et saisies dans le
disseminated within the districts.
Les journées spéciales nous ont permis
About,
de rapprocher
we can see that these special days have many benefits.
de la population.
We can really enhance the geographical access and reduce the financial barrier to family planning for very undeserved populations. We also noticed that it was useful to increase the use of modern contraceptive for long-term contraceptive methods. And this is very important because it was also a way to recruit a high number of new users in family planning methods, and also young users from 15 to 24 years old, more or less. And this is really good. This is a very good benefit. Now the results of these special days compared to those to this routine offering, like we said earlier. So we have compared 2 indicators: the number of new users female users and the total number of users. So in blue, you can see that this is from the special days that were organized. And in orange, these are so the blue is the new users and the orange is the total amount of female users. As you can see, we have organized 4 special days in the first district, and we had 1,636 overall users. And you can see that within the 736 new users, 88% were recruited through these special days. And now in the other districts in the middle, you can see that we have organized 5 special days. The number of new users were 919, and among these 919 new users, almost 84% were those recruited through these special days. And in the last district, Aloha, in June, so within 1 month, we've organized 4 special days events. And among those 616 new users that were recruited, 81% were recruited through the special days, as you can see in blue here. So that's a really amazing number. And similarly, when we go back to the district of the first district, when you see now the total number of users, of female users, 1,636, you can see that almost 81% of those total users are recruited through the special days. And this is something we noticed too in the 2 other districts. And we can gather from these results that these special days really allow a big recruitment of new users. On this slide, now you will see the effect of the special days on the choice of methods. And you can see on the left that it's a mixed method routine. These are, so you can see that injectables is the method the most used, it's 91%. But if you go on the right, you can see that implants are actually within the same district. Within the same district, we have 63% of implants. You see that while the implants on the first one on the left were 5 only. So now you can see at the second slide the effect of the special days on the choice of method. So before the special days were organized, you can see that again the same implants are only 34, and then after the event, after the special days, then implants go from 34 to 42. And this is the same result again on the third slide, the effect on the choice of method. You can see that on the left, implants are only 18, and afterward on the right, it's 38. So really these special days are really a good way to communicate about implants and long-term methods in general.
Par tranche d'âge, nous constatons
When you look at the results by age groups, during the special days and routine, they come and use the contraception methods. We have observed the same events in both districts. And in spite of its being a public event, special days rush to them and accept new methods. Now let's talk about costs. This approach is costly. And to have a good estimation, we need to take into account different elements. like the logistics, the team, the logistics, the material, etc. As far as we're concerned, the contraception are provided freely by the PNSME. So the government has been involved. So the cost of one of those special days to recruit 300 clients, it's about a little bit over $900 US dollars. And the PNSME will basically participate about $410 and AmplifyPF $161. So what worked during the implementation? It's the implementation at the district level with the health staff of those health districts. And during those health days, all available contraception methods are being made available. And that's very important. And the data are taken into account, and they are implemented at the regional level. We also were able to purchase goods at the highest level so that it would enable to basically reduce the cost of those special days. However, some things did not work. There was definitely some stockouts. And we do have products, but however, it was a limited amount of long-term methods. And we know that during the special days, this is what the clients are mostly looking for. There was also a stockout at the national level of Xalocaine, which really curbed our impetus and prevented us from operating all the special days that we had scheduled. So what are our recommendations now for successful implementation of those special days? We must have a national guide for organizing those special days to basically align all the different competencies and partners in the field. We also need to put into place a plan to provide all the products and also integrate those special days at the district level and use all the available channels available in that health district. So I want to thank you now for your interest, and I will give the floor back to Dr. Lassana. Thank you so much, Dr. Teichi. Can you please log out of your screen? Thank you so much. So on top of Dr. Teichi's presentation, we are going to broadcast a 5-minute video, which supports and highlights what has just been said and provides some context. This video shows, through specific testimonies, how the AmplifyPF project had a significant impact in Côte d'Ivoire, with technical and material support on site. Aleida, whenever you're ready. in Dalois and everywhere in Côte d'Ivoire, access to
Après mon accouchement,
these services are challenging. After I gave birth, which was very difficult, they decided to give me surgery. After surgery, the midwives suggested contraception methods to space out another pregnancies by 2 or 3 years.
On dit que c'était 5 000. Vu qu'on venait de dépenser, mon fiancé et moi, on se préparait.
My fiancé and myself, we just had to spend a lot of money.
Et puis il a vu une affiche qui disait comme ça.
And he saw a sign.
Les méthodes de contraceptive.
He saw a sign outside about different contraception methods, and he said, "Well, let's go and check this out."
Une méthode de 3 ans gratuite.
So we decided for a 3-year long-term contraception method. The special days, which meets unsatisfied needs in family
Notre centre de
planning.
santé est le
Our
seul de notre
health
presqu'île
center
situé à
is
14
the only
km
one in our
du centre de
island.
santé
It's
de
40
référence.
kilometers
Avant le projet
away from any other one.
AmplifyPF, la
Before
maternité ne disposait
AmplifyPF,
que d'un seul bureau, affecté
we
pour
only
les
had one
consultations
office
prénatales, postnatales,
for prenatal consultation,
familiale.
postnatal
grâce
consultation
à
visits,
Amplify qui a
and family
identifié nos
planning.
besoins.
And thanks to
Nous avons
AmplifyPF,
acquis
they has helped
un
us to
bureau
meet our
entièrement
demand.
équipé, affecté au
We
service de
have now a new
planification familiale.
office,
Nous avons
which is
également
solely
pu former
dedicated to
2 agents de
family
santé
planning.
communautaires qui mènent
We
les
were able
activités
to
de
train
planification familiale dans la
2
communauté.
health workers
Ça a été pour nous
agents that
l'occasion
implement
de lever
their
tous les
knowledge.
mythes sur les méthodes
And it was a great
à la
opportunity
fin de
to
la
meet,
journée, nous
basically,
pouvons
to meet all
enregistrer en
demands
moyenne
and to
500
respond to
adhérents.
all questions.
Au cours des journaux ordinaires, nous avons
During
une moyenne de
regular
10.
days,
Donc, nous avions en
we have
2021
about 10
une
visits.
prévalence
In
contraceptive de
2021,
6,91.
our prevalence
Mais en
was
2022, nous sommes passés à
10.91, but in
23,54.
2022,
C'est un pas de géant.
we moved significantly up. So it's a significant increase in prevalence.
Avant le projet AmplifyPF, l'accès
Before
à la PF était un peu
AmplifyPF,
difficile parce que la gratuité
access
n'était
to
pas
FP
effective.
was very,
On n'avait
very
pas
hard because
régulièrement
of
de journées
lack of free
spéciales
products.
et on n'avait pas de
We
la
didn't
formation
have
continue,
any
les
special
formations
days,
spécifiques.
and
Depuis qu'on travaille avec le projet AmplifyPF, beaucoup de choses ont
since
changé
we've
parce
been
que
working
Amplify
with
nous a doté de matériel
AmplifyPF,
pour
it's
renforcer
been
nos
so
plateaux
helpful.
techniques dans
We've
certains
been
outils.
provided
Et on a
materials
eu
to
aussi
reinforce
la chance de bénéficier
the delivery,
des
but also we
rapports,
benefited
des fiches de
from
consultation, des fiches
from the
individuelles,
different
des
information,
récits de
individual
consultation et des
reports,
formations. Il y a d'ailleurs même 25
and
prestataires
also
qui ont été formés
training.
sur la PF du postpartum immédiat, la PF du
And we
post-abortum.
provided
Et
new
on a eu la formation
information
aussi des
about
ARC et les produits de
postpartum
contraception pour continuer la PF
after
dans les communautés.
delivery so that we can continue
Le
our
projet
work
Amplify
and
nous a
serve our
permis la
communities.
gratuité effective et améliorant
We were
aussi
provided
nos
free
indicateurs
access
de santé
to
par
FP,
l'organisation des validations de données qui se fait chaque trimestre.
and we were able also to validate our data on a
J'ai
quarterly
demandé
basis.
aux autorités d'amoindrir le coût des méthodes de
So
contraception.
the idea here is to really reduce the cost of access of long-term
Il y a des
contraception
femmes qui ont besoin, mais par manque de moyens, elles n'y arrivent
because many of women
On va
need
demander au
it but don't
gouvernement
have
de
the
réaliser
means.
cette action et l'étendre sur
We
toutes les
want the
jardins du
government to
territoire
help
et puis
us make
veiller
this
avec la
action
formation qu'il n'y
sustainable
ait pas de rupture en intrants et en
and make sure
produits.
that there's no stock out. Since the launch of this project, AmplifyPF has set up about 99 special days. This video is made possible thanks to the American people through the agencies, through USAID. Thank you so much, Aleida. Now I'm going to give the floor back to Dr. Damimba so that he can continue the moderation of this webinar. Thank you for this presentation and for the video, which showed a little bit how concretely and an example of partnership with the government at the district level. Doctor, can you please turn on your video? Thank you. There you go. So my first question is going to go to Madame Kofi Nathalie. Can you explain, please, how those special days are being organized in your health district? Very briefly, please.
OK. Merci, docteur.
Thank you, doctor. Hello, everybody. When a special day is organized, I identify ahead of time the sites. I inform the different persons in charge, but also the FP focal point, which will be in charge of informing all the health worker agents that work in the community and bring awareness. I identify the midwives that will come and help the internal team, and I also inform their leaders. During the day, we expect the population. We work with the council, the local council, and we explain the goal of this meeting. We show the whole breadth of the methods that are being made available, and we tell about the side effects, etc. And then we give the floor to them. They ask a question, and we basically answer all questions, remove all the taboos and all the doubts about contraception. And then we move on to the actual visit. And when we are with the client, there's some counseling happening. She gets to choose her method. We talk about the pros and the cons of the product that she selected, the side effects. So she's been given an appointment, and we tell her to come back if there's any issue, so such as spotting or pelvic pain or strong headaches. At the end of the day, we go over the whole day to try to define what has worked and what hasn't, and what products we need to reinforce, and which also enables to go over the new users that we have selected and we have identified. At the end of 3 days, we draft a final report with final conclusions, with information that we need to provide maybe at the district level or the ministry level, but also to partners. And that report is being sent out to the health district, which is then provided to a DHS2. May I take the floor, please, for a question? For 1 minute. Yes, please, go ahead. To bring a little bit of context here, I would like to ask Mart if she give us maybe some of the people that are going to introduce who our panelists are. Mart, can you please give us an idea of who we're going to be talking with? Of course, Barrier.
Oui, Barry. En effet, la personne qui vient d'intervenir, il s'agit de Madame Kofi Nathalie.
Indeed, the person who just talked is Nathalie, who is a coordinator in the district. And we also have Dr. Aria, who is the doctor within the health facility. We're going to also have Mr. Anzo, who is the coordinator of the National Mother and Child Program. Very well. Thank you so much. Dr. Lassana, I give you back the floor to you. Thank you. Dr. Damiba. Thank you very much. Thank you, Nathalie, and for explaining procedure for these special days. Now I'm going to ask Dr. Ariane and Gessan, because I know that women really come to these special days. And I wonder, how come you managed to get those women come for those special days on purpose? Well, thank you, doctor. Indeed, women come in great numbers, and we work very hard for these 3 days. But it's true that partners do help us, and also we need the involvement of health facilities. So we need to make sure that all women are registered, and we also give them appointment cards. They have individual appointment cards that we can put in our schedule so as to make sure that everyone has the same information, and we also get their address and all kind of contact details, so that we have all the information we need to contact in case they don't show up to the and how can I explain? They have, if they are worried about effects of contraceptive methods, this is really the time for us to reassure them and to let them know how to understand that it's important to prevent the interpreter is sorry, but the sound is interrupted. Thank you so much. Thank you, Dr. Engels and Ariane. I will now ask Dr. Nkaku, who represents the Mother and Child program, health program. I would like to have your opinion on these special days of family planning, and what is the contribution of the national program for these special days? What do you think about these? Thank you very much, Doctor. Thank you, Dr. Alain. I would like to say hello first. And I would like, before I answer the question, I would like really to thank USAID for really providing help on these issues of family planning. So to answer your question about the participation to this activity, this is whether communities or partners organize the events, we are always involved in the preparation of the activities. And like it said, we make sure that all providers are invited. And within the strategy, it's a very important strategy, because when we identify the users, we realize that there are many needs that are not answered, and there are not enough resources to reply to those needs. And that's why we think that it's important to give access to methods. And there are some practices that increase. In some practices, costs are increased. And in order to give information to the population, then we have to discuss about all offering, whether it's about abortion or delivery or preventive methods. This is information we have to give to women, but to the population in general. And this is really a great opportunity for us to satisfy those needs that are not answered. And I believe that this strategy is excellent. However, it's also limited in time, because then what happens after these 3 days? If we can pay for the services, and how can we get more provisions, more supplies? This is something I think is an issue, but it's a really good opportunity for providers to get in touch with their patients and to allow more access to our products. It's a very good event, in my opinion. Thank you very much. Thank you indeed. We will go back on this issue that you just raised about sustainability, indeed. But first, I would like to give the floor to Dr. Moïse. But what is the system you use? I think Dr. Ando talked about it, but I was wondering if you could talk more about how how do you do? Which system? How do you get the supplies for these events? So that's the first question for you. Okay, thank you, Dr. Alain. Indeed, to get more supplies for products, for contraceptive products, we actually use the national network that is in place for the maternal and children health, infantile health project. And it depends on the activities that we want to conduct. But the idea is really to make to work with partners to make sure products are available for these special days for that so that these contraceptive methods are available for these special days. So for at least for these special days or within or for the international days of contraception. This is the strategy we follow. Thank you. Okay, thank you, Dr. Moïse. Now, I would like to ask Dr. Nguessan Ariane to ask to better understand, do young people, whether they are boys or girls, how do you handle them? How do you welcome them? How does it work when they come? Do they have problems with their mom, with their mothers or their aunts? How does it work? How do you? Thank you, doctor. Indeed, we have a lot of young girls, much more than young boys because they're a little shy. So during the special days, we don't really have boys, but really a lot of girls, of young girls and young women, and have like very young girls and young mothers. There are no taboos. We talk about everything. And what we do is that when we raise awareness, first, we are going to congratulate them for their willingness to come and see us. The interpreter, sorry, but the sound is very bad. As for young boys, they usually come for routine consultations with their girlfriend so as to better understand what a contraceptive method is. The interpreter, sorry, the sound is bad again. Thank you. Madame Kofi Nathalie, I know that there are several countries who are listening to you, and some countries are not partners of Ouagadougou. So according to your experience, if you had lessons that you learned and advice that you would like to give to other countries who wish they could start these special days, start implementing those days, what would you say? What would be your advice, your recommendations? Thank you, doctor. Thank you, doctor. Do you hear me? Yes, yes, we can hear you just fine. The good thing of these special days is that they allow to have a lot of new users, so we can register them in our system. And according to the advice and recommendations to other countries, I think it's a very good thing to implement because within the community, it creates, you have to make sure that you have enough women. And also you have to make sure you have all the offering of products, of long-term contraceptive products. Thank you. Thank you. I will ask Ando to further the comments. Do you think that special days could be an alternative to a context where there is no free offering of contraceptive products? Would it be a way to raise awareness about this issue of sustainability, as we talked about earlier? How can we make it last in time, and how can we make sure that the cost is not a barrier, a financial barrier, for so that people can access, the population can access to those products for a long time, for long term. So how do you see the special days happen in your country, for example, and how do you see the future? Okay, thank you. Thank you, doctor. Before I answer the question about, I would like to talk about our community here. What one of our features, it's free, it's free access. And this is for, it depends on political will a lot, in my opinion. And if we have a president who come to your country and another one is coming to your county, and all the presidents that are the candidates are going to distribute free products, of course you're going to take them because you need those products. And instead of having your child who got excluded from school, instead of going to private school, you are going to use every means possible to make sure that they go in public school. So if you have the means, the resources, you're going to use them. So there are many people who actually say that gratuity plays an important role. And this is something I heard also earlier, is that we saw efforts were made. And we see that sometimes the routine efforts are sometimes lower than the special days efforts. And it's not okay. This is not acceptable. This is not enough. Because if you cannot have all the products you need for the population, you have to reply to those needs. Because if you look at the same time at those days, if you imagine we have the product, and when those special days are happening, it's for free, and we still have the product when the special days are gone, but now you have to pay. So how is this working? I mean, people need to have it for free all the time, not just during those special days. How can we make sure that people have access to those products for free all the time, because they need those products, and they cannot just access this product for 4 days, for 3 days? And this is really something we have to think about, because within our strategy to implement gratuity for every day, this is where we are now, this is where we stand. We saw the results. We saw that the population adopts these methods, and we don't have the means to go beyond those special days and make it for free for every day. This is really something we need to work on, because acquisition of contraceptive is the problem. We want product for free. We cannot say that products don't exist. Because we know products exist, we know that products are here. We just need them to be free. We need to make sure that those products can be accessed for free, and whatever age you are, whoever you are, wherever you're coming from, no one should decide if you can use or not a contraceptive product. This is something you can decide for your life. It should not depend on how much you earn. And this is really something that we need to work on. We need to make gratuity, free access, sustainable. We have to work with partners. We have to work with other. There are many partners we work with already, and there are many partners we should work with in the future to make sure to have products all the time, and to have products for free all the time, even for 10 days, 10 years. And we will notice that the population will change. We'll notice that the state of the mentality will evolve. And for sure, for people who have a lot of children, this is something that they cannot access maybe. And then we cannot put these children to school. So this is a long-term problem that we have to handle. It's really important for a family to be able to choose whether they want kids or not. They have to choose to be able to choose whether they want children or not, because then it's a problem for them to put them in school and to take care of their health and to drag them to the doctor. This is what I wanted to say. Thank you very much.
Thank you so much for your perspective, especially on a national perspective. I'm going to now ask questions that were posed in the audience. And Mrs. Kofi Nathalie, question is for you. Could you please explain why this method choice was different during those special days? Is it because that implants are usually more expensive? Why are these long terms selected during the special FP days? Madame Kofi, if you can answer this question, please. Thank you, doctor. During the special days, yes, they tend to select long-term methods because they used to be the most expensive one. And they do feel safer over the long term. So they're being protective over 3 years and sometimes for 5. So for those who really want to space out pregnancies, they prefer long-term methods. Thank you. Thank you so much. Second question in the Q&A section. Do you have specific actions to favor access to women that disabled people or people living with disabilities during those special FP days? Have you set up specific strategies so that these disabled women can benefit from these methods? This is Dr. Nguessan. Maybe you can answer the question, and maybe somebody else can intervene as well. Special days are open to absolutely everybody and go and last over 3 days. So yes, women with disabilities can come with somebody with support, and they will be given priority, especially if they have issues walking, or so they will be welcomed before the others. Yes. Dr. Moïse, can you also please talk about the activity happening in Abobo, in Abidjan, with the Association for the Deaf and Mutes? Thank you, Dr. Alain. Especially with those disabled people, the project AmplifyPF, through its activities and its young champions, is in contact with an association of disabled people, especially for the deaf and hard of hearing. And the project was designed with them in mind, so that they can have access to FP information and also to use these methods. Before, they experience challenges because no one would talk to them about these methods. So thanks to those young champions, we were able to convey these FP messages to this population, to these groups of population, and things are going great. They receive information on FP, So that's what's being done with young champions. Thank you. Another question in the Q&A. This is for Ando Yasant. I would like to know how is this happen? How does this authorization happen? I don't know where this question come from, but so how do teenagers use contraception, since they normally need parental authorization? So we're talking about the legal framework here. Are there any restrictions? What can they have access to in Côte d'Ivoire from a legal perspective? Thank you so much. Thank you. In Côte d'Ivoire, we had a specific program dedicated to the youth and teenagers. And this program was a free service. Most of them are free, including FP. Before, it used to be the youth in a school environment, and now it's for all of them. So all of them, all the youth that needs access to contraception can go to those, they can have access to this program. And we've noticed that many parents are complaining about it because the child is still a minor. So basically, the legal framework did not allow us to do so. So that being said, since 1999 in Abidjan, where we voted a law, all the countries did not. So basically, to sum up, Côte d'Ivoire didn't have a law on family planning. So we were confronted to this problem because sometimes the populations complain. So when it's about getting the authorization from the father, for example, but we are adults. Did we ask? We don't do that. So we want to go beyond that barrier of asking a parental, because we didn't do it in the past. You know that. So today, we want this law to see the day so that we no longer have this barrier because of a legal loophole here. Anybody who is sexually active should have access to contraception. This protocol was ratified by the government of Côte d'Ivoire and by the president, and it should have been implemented, but it hasn't happened yet. And for family planning, it hasn't happened yet. The law is not specific and doesn't say that you need to be major of age, but the law does not promote the use either. So we have some legal blocks here, which are not insignificant because it prevents us from doing the promotion. Otherwise, we want to integrate it within schools, in the nurse office, for example. But it's some other methods are not fully accepted. So this is the problem we're experiencing. Thank you so much for all these details. Now a question that's taken from the Q&A session. This is a question for Kofi Nathalie. How do you manage the lines of all the women that come, where you have maybe 100 or 200 women that are here, all the clients? How do you do? Is there any triage, How do you mitigate the expectations for, especially for the one that came at 7 a.m. is not being welcome before the one, or after the one that came at 8 a.m. So how do you accelerate the process? How do you mitigate those? How do you avoid traffic jams, so to speak? Thank you so much, Doctor. We have a team in place, which is on site, and we strengthen that team with other midwives. So we have like 5, 6 people to accept, to welcome everyone. There's no trouble. Everyone is being welcome and being attended to. Thank you. Dr. Nguessan, Ariane, how do you bring awareness to the community and also to announce and to communicate those special days? Do you use the radio, TV, posters? How does it work? How do you communicate?
De façon pratique,
Oui.
De façon
Oui, comment
pratique,
vous faites?
nous sommes dans un village.
So we live in a village. So we bring the information to the head of village and the chief of the neighborhood. We also work with community leaders. There's also association of young women, and all these women gather the information before anybody else, and they will relay the information to the population. We also work with a local radio. They also convey the message. The day before the special day and one day after, there's the interpreter has a problem, cannot hear the speaker because of connectivity issues. Dr. Darima? I had a hard time. I know there was some connectivity issues there.
Est-ce qu'elle a fini de donner sa réponse?
I couldn't hear her. What I was trying to say is, anybody who would like to speak can raise their hand, and we will let you have the floor right now, because we have 17 minutes left. Maybe we want to give the floor back to, but unfortunately, Ariane, we don't have good connectivity. Maybe we can give the floor to anybody who has a raised hand. Mr. Guilhem? Guilhem, who has, please, you have the floor. Activate your mic, please. Thank you. Good evening, everyone. And thank you for this presentation. Thank you for the invitation. Great and interesting exchange of information here. Thank you for this approach of special days. I'm a project manager assistant for sexual and reproductive health. And women, what is the difference between communication campaigns and those special days? The interpreter has a hard time hearing what's being said. So what are these differences?
Merci, Docteur Davimba. Vous pouvez
Thank you, doctor.
How do we do? Should we ask everyone to ask questions or reply right away? Well, maybe I will ask Andrew to answer this question about the program. Yeah, sure. Thank you very much for giving me the floor again. Our special days, like we said earlier, the objectives, of course, are different from one open door to another, but the idea was to raise awareness on one thing and then on another. And what we did, what we do is that we coach people. And this is something very specific because then it's as if we were opening a service and we were talking to a larger group of population and talk about gratuity. And it goes with the capacity building activities. And this is the difference between open door and special days, because we capacity building, gratuity, and communication. This is the difference. Thank you so much. Thank you for your answer. Asana, you have another question? Yeah, there's another question from Sarah Bazoum. Bazoum, Sarah. You can talk. You can activate your mic. Hello. I'm sorry, the connectivity is very bad here. Maybe you won't hear me. Yeah, I'm so sorry. I would like to talk, but I'm in the bus and it's not easy to hear. The connectivity is very bad. Okay, no problem. So maybe Mr. Sakasumoro, you can activate your mic. Mr. Sumoro? Mr. Sumoro, can you hear us? Would you like to activate your mic? Then Mr. Abdoulaye Diallo? Yes, go ahead. Hello. Welcome. Yeah, I'm Abdoulaye Diallo. I'm Dr. Diallo. I come from Pathfinder 2 in a region with a senior advisor, and I work with Gaini. Thank you for giving me the floor, and thank you for this opportunity. There are many questions I would like to ask, of course, but I would like also to hear about the experience of Côte d'Ivoire in capacity building during those special days, because it's really a good opportunity for us to contribute to the quality of the services in the offering. And also for implants insertion, was there any issue? And how did you handle these issues, if any? There's something else I wanted to ask also is related to the quality of data. Was there an issue with the quality of data? And if so, how can we collect quality data? This is really something important for us and for decision making. So I would appreciate an answer. Thank you. Dr. Ariane Gessan, would you like to reply? Sure, I would love to bring contribution, and this is a question that was asked to me. So regarding the mobilization of communication methods, we are in a village. We have a chief, a leader in the village, and we have district leaders, we have community leaders, we have also association presidents. And first of all, this is where we give information first through these people. And one day before the special days, some people are in charge of disseminating information. We also have a radio, a local radio that we use to communicate. Okay, I see. Thank you. There was also a question about the training of agents and how do you do for collecting and analysis, collecting and analyzing data? Maybe you can shed some light. Yes, sure, doctor. Thank you. So regarding the first question, in fact, it's not about theoretical information. It's really about providers who have a training and they learn on the spot how to do their work, how to provide these services. But this is something they do locally or nationally, and they can go to facilities. And in any case, this is something which we target, of course, individuals or providers that do not have the required skills. And then we organize a training. And when they go on the practical stage, we usually don't have enough clients. But this is where an open door is a very good opportunity, because then we can practice with these providers. So the strategy is not information for everyone. It's really about targeting people who have difficulties so that we can help them. That's what we do. So when we do it in one zone, one area, and of course, this district benefits from it, this zone, this area, not all the other areas. I'm not sure I replied properly, but I hope I did. About the quality of data. Well, there is a register with data that is updated regularly, and this is something that goes with a sheet of consultation that includes information about the patient, and all this is done in a technical way, so it goes well. Data is collected at the end of the month, and these are registered that we can view. And at the end of the month, we have a report that we produce. So if you like, it's as if service the department had provided this data. So it's like all this data that we are going to that are communicated by the lady. The lady is going to her appointment, and then she gives information, and then the following day, the product that she has got the prescription for, it doesn't work. So she has to go back, and then when she has to pay for the implant after the special days, then the person is lost because she won't have she won't have the means, the financial means to afford for that product. So and these women will be abandoned. So we cannot just let them go like this in the wild. We just have to hold their hand. We have to make sure we find a way to make it free forever. It's not just for a special day that it should be free, because then women come, they need those services, they need those products, and then they can't access to it. So it's a right. That's what bothers me. It's a right. This is something that women have the right to access. This is something I want to say. Yeah, Dr. Moise? Yes, go ahead. Yeah, I just wanted to further what Ando was saying and talk about the data collecting and the quality of the data. We have tools, as I was stressing before, for collecting data in the preparation of the first step. When we identify the provider, there's a meeting that is organized, and all those tools, these are useful. This is something you can use for tracking data. And then when you define the offering of services, there's the person that is in charge of collecting data and verifying, following up with data, and making sure that all the information is informed and collected, and then the collect of data is daily. At the end of the day, you have to make sure that all the data is centralized and is gathered, and everything that is going to happen every day for these 3 days is going to be tracked and followed up and analyzed and collected. And there's really someone who's in charge of this. And it's important to, this is how we make sure that the quality, the data is of good quality. Okay, so I have a question for Nathalie Kofi about the young, the product that young people use for syringes, for example, or pads or packaging, all these kind of products that they use, there is a lot of waste. And if you have a lot of clients, how do you handle this waste? Can you explain the management of waste for syringes and needles? How do you handle those for preventions for prevention of infections? Thank you, doctor. So for the waste and prevention of infection, we have safety boxes that we use for syringes and needles. And then we have bins where we put cotton pads and other products like this. And then we have a selection of waste. So one is in the bin and the other one is in the safety box. And then we have a bigger bin where we put all the safety boxes and then they are shipped to another facility. Thank you, doctor. Thank you very much. There's another question, maybe for Dr. Ando again, about the national program. When are you going to organize the special days for women who are asking for prevention of pelvic cancer or breast cancer? How do you handle, how do you help those women, those requests? Yeah. Can I just say something? We just have 3 minutes left, so maybe we should speed up a little. Sorry about that. We have to speed up. Oh, sorry, I didn't realize we just had 3 minutes for 3 more minutes. But maybe Dr. Ando, I'm sorry, because it's a tough question, but maybe it won't take just 2 minutes to answer. No, that's fine. Okay, very quickly. Yeah, sure. So every woman who comes, we try to talk to her. And if she's pregnant, we're talking about pregnancy and postpartum difficulties, complications. If she's not pregnant, of course, we will talk about something else. But I mean, for every woman who comes, you have opportunities to talk about her issues. And in this case, the danger of cancer, breast cancer, pelvic cancer, whatever. The idea is to really talk about the screening methods. We talk about it and we explain, and we have to make sure that they agree. And of course, she will decide, but we have to give information about all this. Okay. Thank you so much. Thank you very much. Thank you for the presentations. Thank you for everyone who talked, for the video, for the panelists, for the participants, for everyone who answered questions. Thank you for asking questions too. And this is maybe something I will take away with me, is that the special days have a very important contribution and for family planning. And I think they reply, it seems that they reply to a very specific need and a very important need for the problem of cost. And considering the success of these special days, unfortunately that are not sustainable, but we can say that the results of special days can be used as a tool for advocacy in front of the authorities, so that they can understand that we have to use them to use these special days as a transition, maybe to gratuity, and get free access for every day and not just for 3 days, because this is something that we can show that when access is free, we have much more users. So this is really something, it's like a strategy that can be used to show authorities that free access to products pays actually and offers advantages. This is something also that is I find interesting, is that the choice of clients is limited just because of the cost. And when we have informed choice, it's not informed in routine services because we cannot, we don't have the means to do it. So when we have the choice to inform clients, that's what we do during those special days, is that we can explain women and girls about that, how they can choose their method. So everything, all this to say that I think it's very useful to use advanced countries, to the countries that are advanced in these strategies and this implementation to learn lessons. So thank you very much for your contributions. Thank you for everyone. Thank you for Pathfinder and Amplify teams for having this discussion, for organizing this discussion today. Thank you very much, Dr. Babumba, for this moderating this webinar. I appreciate it very much. And we also, first of all, we wanted to apologize to those people to those persons who could not participate because their connectivity problem or because of time constraints. So I wanted to really thank everyone for participating in this webinar. I want to thank you, thank everyone for all these. There's a question that was not answered, and we will talk about all these issues on in July 20, and we are going to talk about all these issues related to family planning and reproductive rights in Côte d'Ivoire, and we will be very happy to talk more about these issues. And we will be very happy if you can join us in this webinar. Have a nice evening or have a nice day, according to where you are. Thank you. Thank you. Have a nice evening. Have a nice day. Thank you, everyone. Thanks. Have a nice evening.